Hello, I'm Dr. Nuran Al-Banna, and today I'm going to discuss case 68, Odell book. The case is titled under Should I Repair or Replace These Restorations? The 5 Rs. And I will begin from the what are the 5 Rs, because it's what the whole case is built on. The 5Rs is a concept of minimally invasive management options for the failing tooth restoration complex. The first is review, and then refurbish, reseal, repair, and replace. So, in case of review, we just monitor the case and the minor defects when there would be no clinical advantage in undertaking any treatment. While refurbish is correction of small restoration defects to prevent further deterioration. Reseal, application of sealant material into non-carious marginal defects. Repair, addition of material to defect in an existing restoration. And replace, removal and replacement of an entire restoration. Okay. What is the case summary? It is a 40-year-old woman presents as a new patient at your general dental practice complaining of 2 fractured teeth and requesting advice on treatment options, assess and diagnose the condition of the restorations and identify the management options that can be presented to the patient. Okay. الهيستوري هنا إن the case has many defects in many restorations. It ranges between composite and crowns, porcelain fused to metal crowns, and each need a kind of intervention according to what we will going to do or the assessment of the case. The history, usually you begin with the history. The patient recently fractured 2 teeth whilst eating. The mandibular right first premolar, which is uncomfortable on biting and is sensitive to thermal stimuli, and the maxillary left first premolar. The patient also has composite restorations on her maxillary left central incisor and mandibular left first premolar, and is also concerned about the appearance of porcelain fused to metal crown restoring her maxillary right first premolar. Dental history: the patient hasn't visited a dentist for 7 years, and previously she was a regular attender and underwent a range of restorative procedures between the ages of 20 and 30 years. She has a healthy diet, good oral hygiene, and no medical conditions that would complicate dental treatment. While examination, we find fractured mobile distolingual cusp on the mandibular right first molar adjacent to an occlusal amalgam restoration, fractured buccal cusp of the maxillary left first premolar adjacent to mesio-occlusal distal amalgam, marginal staining of class 4 resin composite restoring the maxillary left central incisor, marginal staining of the occlusal resin composite restoring the mandibular left first molar, and open buccal margin on the porcelain fused to metal crown restoring the maxillary right first premolar. So many unrestored teeth. The assessment of failing restoration. Assessment of failing restoration was built on what is called the functional criteria. The assessment of the whole mouth restoration was done under Haeckel classification system. Haeckel classification system is based on 3 main criteria: aesthetic criteria, functional criteria, and biological assessment. So the aesthetic is according to the three criteria has definition. Definition is how good the whole restoration appears as. So definition: surface luster, surface staining, color stability and translucency, and anatomical form. This in case of aesthetic. We have 5 grades: 1, 2, 3, 4, and 5. 1 is an excellent restoration, and 5 is the worst restoration, which needs replacement. And 2, 3, it's a kind of acceptable restoration in case of 2 and in case of 3, but we may interfere according to the amount of defect in case of 3, and we may interfere in case of 4 too. Between 3 and 4 we may do a kind of interference according to the amount of defect too. So according to the score, we may choose an option from the 5 Rs: either review, refurbish, reseal, repair, and replace. In case of any restoration is under Haeckel assessment as a biological or aesthetic or functional, it takes 1 or 2. We will go for review, okay, or refurbish, just it. In case of 2 and 3 and 4, we may do a kind of reseal or repair. In case of 5, we will replace in all cases or on all criteria. So surface luster, surface staining, color stability and translucency, and anatomical form. In case of functional criteria, we see definition, fractures and retention, marginal adaptation where contact point, foot trapping, radiographic examination where applicable, sometimes it's not applicable, and patient's view. As in case of veneers, pre-apical x-rays will be somehow useless, especially if there is no real defect clear incisally, or the veneers are so superficial, doesn't overlap the incisal portion or lingual mesial distal contacts. So biological assessment, it shows definition, post-operative hypersensitivity or tooth sensibility, recurrent pathology, tooth integrity, periodontal response, adjacent mucosa, oral and general health. We have to take care that in case of the biological assessment, we are not only assessing the restoration as in case of aesthetic and functional, as we are here assessing the oral and general hygiene too, because if we have a very bad oral hygiene, it's useless or doesn't make sense to make any kind of interference until the patient gets back its normal or optimum oral health measures while we are managing the case, because we use Haeckel assessment in order to be able to manage the whole case, not just take a decision what to do within the restoration. In this case, we find many things as clinical view of a kind of marginal staining in case of lower 6. We find unpleasant anterior restoration, it has to be remade. And we find a kind of severe gingival recession in the premolar, so we remake the case, the portion fused to metal restoration. And we all put in mind what the patient is concerned about. It was mainly the aesthetic. The patient was searching for aesthetics. And after rebuilding up everything and making everything within the normal and be sure that the whole case is now completely good, we give the patient the main piece of advice, or we highlighted that the patient has to keep on her regular checkups, annual checkups, because she has good oral hygiene. It's not a high caries risk case. Yeah, it has many restorations, but there is no recurrent caries or active caries in everywhere. It's just initial caries or broken restoration. So From the oral hygiene point of view or caries assessment, she is a very good patient. But still, if we have a patient with many restorations, heavily restored dentition, the patient has to visit the clinic or the dentist at least once per year. Thank you, and see you in the next video. And please don't forget to see the shared questions below in the description box. Bye bye.